Hi, everyone. I'm Cliff, and this is Life with MS. Today, we're going to be diving into a recent study that sheds light on how different types of health insurance might impact the experiences of people living with MS here in the United States. This is a timely topic because, well, there's a lot of disruption going on in the health insurance space right now. But this study really shows some interesting stuff. Now, we all know that having access to good healthcare is crucial, especially when managing a complex condition like MS. This study, published in the Multiple Sclerosis Journal and linked below, took a close look at the medical records of 160 individuals with MS who were treated at Rush University Medical Center in Chicago between 2017 and 2022. To understand the context, MS, and you probably already know this if you watch my channel, is a condition where the body's immune system mistakenly attacks the protective coating around the nerve fibers, and this damage disrupts the signals between the brain and the rest of the body, leading to a range of really crazy symptoms like fatigue, walking difficulties, numbness, cognitive problems. The researchers in this study wanted to understand how things like insurance type and socioeconomic factors might play a role in how well people with MS manage their condition. They specifically compared outcomes for those with private health insurance to those covered by Medicaid. For those of us who might not know, Medicaid is a government program that helps cover medical costs for people with limited income and resources. It's a joint effort between the federal and state governments as of right now. Here's where the findings get very interesting. The study revealed that people with MS who had Medicaid coverage experienced significantly worse disease outcomes compared to those with private insurance. And you have to ask yourself, why? Let's put some numbers to that. The researchers found that the risk of MS relapses, those times when symptoms suddenly get worse and new ones appear, was 6 times higher for patients with Medicaid compared to those with private insurance. They also found that the risk of disability progression, meaning their MS got worse over time, as measured by the standard disability scale, was more than 4 times higher for the Medicaid group. Study also looked at demographics for people involved. Out of the 160 participants, the average age was 35. Most were women. Nearly half, let's say around 78, were white. Significantly fewer than one-third, around 51, were Black. 20%, or about 32 individuals, were Hispanic and Latino. And around 81% were employed, while 59% had a college degree or higher. A large majority, about 119 individuals, had private insurance. 41 individuals were covered by Medicaid. When the researchers started crunching the data, they found notable differences. The Medicaid group was younger on average, 31.9 years old, compared to the private insurance group, about 36 years old. A higher percentage of the Black individuals, almost 44% of the Medicaid group versus 26.8% of the private insurance group, and the Hispanic Latino individuals, about 26.8% of the Medicaid group versus 15.2% of the private insurance group, were covered by Medicaid. A larger proportion of the Medicaid patients were unemployed, 30.8% versus 2.6%, and had a high school diploma or less education, 38.5% versus 10.2%. Conversely, the private insurance group had a higher percentage of white individuals, 56.3 versus 29.3, were more likely to be employed, 90.6% versus 53.9%, and had higher levels of education. The study also found that individuals on Medicaid were more likely to have more mental health conditions and faced more difficulties with transportation, leading to more missed appointments. There was also a delay in starting disease-modifying therapies, or DMTs as we know them, which are medications that can help manage MS. For the Medicaid group, with insurance barriers being a key reason for this delay. However, once people were on the DMTs, the study found that both the Medicaid and the privately insured patients received equally effective treatments. There weren't significant differences in the appearance of new lesions on their MRI scans. This suggests that the type of treatment wasn't the main driver in the different outcomes. The researchers concluded that the worst clinical outcomes for Medicaid patients, the higher relapse rates, the greater disability progression, weren't simply explained by the differences in access to or the efficacy of their DMTs. They believe that other factors, possibly related to socioeconomic challenges and barriers to consistent comprehensive care, are likely at play. The study authors suggest several ways to potentially improve care for marginalized populations, include implementing virtual doctor visits. We know that worked really well over COVID. Providing educational materials in multiple languages. Offering transportation assistance. I mean, if you can't get there, you can't get care. Oh, I like that. Connecting patients with social work or case management services, and linking patients with health psychologists. That one is huge. And I talked about that in a previous episode about how much my cognitive therapy really helped me. In conclusion, the study highlights a concerning disparity in MS outcomes based on insurance type. The Medicaid coverage being associated with worse disease progression and more relapses compared to private insurance. The researchers emphasize the urgent need for more research to understand the underlying factors and develop strategies that ensure equitable and effective care for all individuals living with MS in the US. So, this study is very timely with what's going on with budgets in the United States and what's going on with Medicaid and Medicare. And we'll just see what happens. Have you had an experience transitioning between the federal system and private? And if so, was it good or bad? Comment below if you don't mind sharing. Also, subscribe, like, and share if you found this article and episode interesting. Big shout out to Dr. Andrea Lobo for making mention of this and writing an article on multiple sclerosis news today, highlighting this because it is very interesting. I'm Cliff. This is Life with MS. Until next time, I'll talk to you soon.